So if a child, has a fear of monsters under the bed, and the parent is assigned to check for monsters throughout the night or a bunch of times, that is actually giving the kid a message that there is danger. Because why else would my
Mm.
mom be checking under the bed if there wasn't? So supportive parenting is this balance between not accommodating, which maintains the anxiety, but also not being overly demanding and say like, suck it up, buttercup, right? Supportive parenting is like validating that there is emotional pain, but also showing that you have confidence that your child could deal with it.
Hello, my friend, and welcome to Something for Everybody. My name is Aaron Machbitz. Dr. Elliot, welcome to the show.
Thank you so much. Thanks for having me.
Absolutely. My first and most important question is, how are you doing? Like, actually, for real, how are you doing?
Very well. This is a fun summer. Going camping. I'm going to go to a lake house. I've been doing a lot of fishing. I started a consulting company for people interested in starting private practices. Glasswall Consulting. It's pretty fun. I really like that type of consulting and doing therapy, and I have, very few reasons to complain, thankfully.
Yeah, that's beautiful. Fantastic. I feel the same way, so that's awesome.
Mm-hmm.
But I think to kick off this conversation, let's begin by maybe talking about the mental health of our children. Is it as bad as people are making it seem, or what's going on really with the mental health of our kids?
I think there's a few things happening at once. I think a lot of kids are struggling. And I also think that there is a lot of overdiagnosis, right? I think sometimes we're seeing problems that kids are experiencing and viewing it through the lens of diagnosis and mental health, where while it is mental health related and you could technically tie a diagnosis to it, I do think there are some fundamental challenges that kids experience nowadays, which is impacting their mental health. I think screen time is a huge problem. I think the internet is I don't think we knew what we were getting into when we invented the internet. Not we, it was Al Gore. But I think it's something that's so detrimental while at the same time being so needed, which makes it so dangerous, right? The same thing you need to function in society that we're using right now to be simultaneously so detrimental for kids, I think is leading to a lot of mental health challenges. And I think, so I think there is a problem that kids are experiencing.
Yeah, what's going on with the overdiagnosis? Is it, based on some of the therapy speak that kids are seeing on social media, and now they're adopting that own language and then using it to just say this is what they have, or is it a little deeper than that?
Yeah, so I think Abigail Schreier really did a great job in her book Bad Therapy, discussing like the therapization of a generation of kids and mental health outcomes not improving simultaneously. So I think like the availability of therapy and the frequency of the diagnosis, I think, are leading to increased reporting of mental health symptoms, which I think is ultimately can be helpful. Like I think when a person has a disorder that is, clear and it's like categorically different than normal childhood pain and developmentally normal difficulties that they're facing, and it's something like an eating disorder or OCD and there are really good treatments for that. I think it's very helpful that they have the language to describe that, and that they have a label, and the label, inherent in the label, is a disorder that has a treatment that's effective for it, and you work to get treatment so you no longer have that label. Whereas I think labeling normative human suffering, which is a part of growing up, is how we respond to the very human reality that there's pain in growing up, there's pain in becoming who you are, and that pain is not something to necessarily stigmatize or see the natural state of being a human as being pain-free. I think like the Buddhists really have a lot of good points about a lot of life is suffering, and that suffering could become very meaningful, and it could be the impetus to you finding what's very important to you in your life. So I think like just stigmatizing developmentally normal emotional pain could be a problem if that pain could ultimately be what helps you find what's meaningful to you.
Yeah. I think there was a bit of an overcorrection maybe, because when I was growing up, it was like, throw some dirt on it. I'm from a sports background, so it was always like, throw some dirt on it, you'll be fine, get back up. Maybe that was a little too hyper, like, don't talk about it, okay? And then now it's like, now it's potentially like, we have to shelter, like nothing can happen, we got to put you in the bubble. There's got to be some sort of middle ground, because there are instances where if I have a kid growing up or a kid that plays on my team, and some like minor incident happens where maybe he falls and like scrapes his knee a little bit, I'm like, dude, you're going to be good. Everything's intact. Let's get back up. Let's keep moving. And there's also instances where like maybe he comes to practice and he's crying, and like maybe something happened at the home, and like there needs to be a deeper conversation about that with a professional, but he wants to come to me because he feels safe with a coach, but I got to lead him to sort of other discussions. I just think like maybe we went too far on either spectrum, and there's got to be a place where we can live in this middle ground. Like nothing's ever going to be perfect. Obviously, life is way too fucking complicated and hard for that. But there can be a space where we have this ability to give kids the freedom to mess up and fall off the tree and get back up, and like talk to them when something really horrible happens. Like obviously this needs to be addressed at a deeper level with a professional like yourself. I just don't think I don't know every kid in America. That obviously that would be crazy, but like I feel like we can get to that place potentially.
Yeah, I totally agree with you. I think it's very wise. But I would also say that parents like will kind of see the therapist as the first line intervention for their child's emotional challenges, right? And I think parents could do a lot, and they shouldn't automatically doubt themselves and think that they don't have the capacity to help their own children. And if they do need the guidance of a therapist to help their children, I think that is fine to get a better understanding. But the way I approach child therapy is kind of like outside in, where, I think it's more helpful to really work with the parents to understand what is it about the environment the child is in, which might be maintaining particular emotional distress, or a pretty popular treatment, let's say for childhood OCD, is what's known as SPACE, which is supportive parenting for anxious childhood emotions, developed by Dr. Ellie Leibowitz at Yale Child Study. And in that treatment, they're recognizing the role of parental accommodation as a maintaining factor in a childhood's OCD, right? So, or anxiety. So if a child, has a fear of monsters under the bed, and the parent is assigned to check for monsters throughout the night or a bunch of times, that is actually giving the kid a message that there is danger. Because why else would my mom be checking under the bed if there wasn't? So supportive parenting is this balance between not accommodating, which maintains the anxiety, but also not being overly demanding and say like, suck it up, buttercup, right? Supportive parenting is like validating that there is emotional pain, but also showing that you have confidence that your child could deal with it. And that's like an extremely powerful stance a parent could take. And what does it mean to be a support? Is like, your pain is real. And also I believe in you that you have the capacity to overcome it. And that's an example of like a way a parent could really, upon learning certain techniques, be so therapeutically valuable to their child's needs.
Yeah. I'm not a parent yet. But I'm getting married in September. And so hopefully, thank you, God willing, we'll be able to have children next year. And so maybe my feelings and thoughts will change actually when I have a child that I have to actually care for and love.
Right.
But I imagine as a parent, it's just so hard to see your child suffering that you just will literally do anything to make it stop. And I get that because I have two amazing parents who I fucking love. Shout out to my mom. She listens to every episode.
That's awesome.
And so I get that, but so how do you try and tell parents that some suffering or some pain, let's say, not suffering, some pain is okay. Some discomfort is okay. Like, how do you let them see their child in that discomfort and say, like, it's going to be okay? They got to feel that emotion. They got to feel that sense of what it is. So they know what it's like when you're not around or something happens or they get rejected or whatever the case may be.
Great question. I think you could see it as a parallel process, that the anxiety of the child and the mom or the dad are very linked, right? So the mom will experience, almost like vicariously experience, the distress of the child, like what you're describing. So, whether it's space or exposure therapy for a child's anxiety, where they incrementally allow themselves to be exposed to small doses of the things they're afraid of and increasing that, and in doing so, learning that they are capable of feeling that distress, parents too can learn that for the good of their child, like almost an exposure therapy paradigm, like they could learn to accept small doses of their child's discomfort, and learn like they could handle it for the sake of their child. And like, just like a parent who has to give, shots to their kids for a particular condition and the kid is crying, but they'll kind of like intuitively know, like the kid needs the shot, so they'll be like, I'm going to like hold it together because I know my kid needs it. A similar thing happens when it comes to their accepting their child's suffering when it's the right suffering, right? I think parents might be more willing to kick the can down the road to avoid suffering, right, for the short term. So if you have a teenager who's like stuck in the room playing video games all day and is totally not getting it together and like preparing for his next stage in life, like not getting a job, not going out, not even getting in trouble, just kind of. So a parent might like say like, go out, go do something, go get together with friends, go like look for whatever it is. The kid will like say, get out of here, like don't put this stress on me, like. So the parent will not want to have that type of fight, will not want to see their kid experience distress, and will allow the kid to just continue avoiding pain, which we could like, as a kid, we'll be like, okay, he's a teenager, but without having that push as a teenager, it's much harder to do it as an adult. And that's why you're seeing like a great increase in like failure to launch, where launching itself is not even seen as a laudable thing for some kids. Like they'll be swept up in a culture that says like capitalism is bad and success is bad and it's all part of the patriarchy, blah, blah, blah. So even the thing which like we have known forever is what a child needs to grow and to thrive and to become a happy, well-adjusted adult, they're undermining in a lot of parts of culture. So I think, getting back to that first question of like the types of challenges the kids are getting these days are the messaging that they're getting about success and its importance or lack thereof.
Yeah, I mean, it makes me think specifically about some of the young boys that I know, like in their sort of retreat from society, like getting their driver's
Mm.
license much later. Like every kid and friend that I had growing up were like, man, we need to get our fucking driver's license as fast
Yeah,
as
right.
possible.
The day
Like,
of.
and that was like not because we didn't like the environment we're in, we just wanted to have that sense of freedom. Like, and in my friend
Yeah.
group, like none of us were talking to girls, so it's not like we were just like we're too shy, we didn't know we were, whatever, like all that normal stuff. But we just like wanted to roll around and drive around the city. And like the first guy in our friend group, Evan Roth, who got a car, we were like, yes, Evan, you're the man. We're going with you, bro. Let's go. And it was like a cool sense of like, being with your boys, just getting out and having freedom and like nothing outside of that. But now it's like seems like later and later they're getting their driver's license. They have to be pushed to get that. And I know that's a small sort of microcosm of like the whole thing, but it's the messaging about, what masculinity means and our own mental health and how we view ourselves. And when I look in the mirror, can I really be a strong man, or do I need to step aside for someone else to take over? Like all of these messaging, like, and young people are impressionable, as we know. And so they're going to try and do the best they can to fit into society. And if this is what they hear, then this is what they're going to do. And clearly it's not the right trajectory for just young people's overall well-being.
Yeah, and I also think if you look at the content of what they're watching in these videos, like let's say on TikTok or Instagram, you'll see so much adventure that they're watching, right? Like
Mm-hmm.
kids jumping off, cliffs into a river, or doing these crazy pranks, and like so it's almost like they're meeting that need of adventure and excitement vicariously through
Mm,
other kid influencers having these amazing times.
yeah.
And then they they're doing that till 2 in the morning instead of getting into their own adventures. So I think like that's part of that challenge is that, they're having that need met in ways that don't benefit them.
Yeah. That's very interesting. Hmm. Are there any other tips you have for parents potentially that might have a kid who's struggling with this sort of challenges of just being a little kid nowadays, or anything else you've come across that's insightful or helpful?
Yeah, I think parents should know that it's never too late to change the direction of their parenting, just like it's never too late for your child to change, what's wrong with going on in his life. So so if parents are recognizing, and this could be extremely difficult and every case is unique and different, and like some parents are very, you know, they'll be totally against any screen time, and their parents were like, no, if we say no to screen time, they only want it, they only want it more. So all advice needs to be very tailor fitted to a particular, every particular situation. But generally, it's never too late to change the way you're parenting. Um, and if what you're doing is not working, like don't just rely on the status quo because things don't change by themselves. You could make changes, and it's never too late to do so. So, by the same uh, researcher, Dr. Leibowitz, who came up with space, he had one of the only treatment protocols for failure to launch in adult children who are, not working, not supporting themselves, very often with a lot of comorbid mental health conditions, and how to actually help these kids by, these adult offspring, right? Like how to actually change the way, the cycle that kind of created these circumstances. Like you are able to help them by making the thing that that they're supposed to do easier and the avoidance harder. And he has this whole protocol where he, you go through, these very reasonable expectations and slowly build your way up by incentivizing the, reasonable expectations and having, certain things contingent upon him making slow but steady progress. And the only way off that island is to swim, and it's never too late.
Yeah, it makes me think about when Dr. Jordan Peterson talks about cleaning his room. He's like, your room could be an absolute fucking mess, and every day you could be stepping over the same vacuum. But if you make the decision that you're going to put one sock in the appropriate space, you've won. You've set the expectation where you can meet it. You met it. You put the sock in the drawer, and then you just start to build from there while you have the encouragement and you're, being encouraged to take responsibility for that. It's the same idea. I mean, in a similar idea, not exactly the same, but I think that's I think that's why Dr. Jordan Peterson is so beloved by young men, because they're like, oh, someone's telling me that I can actually do something. Someone's telling me that I'm actually capable of something great, that I can use my tools to help the world, to be the best version of myself. And that's a powerful message, because you could get trapped in many different circles there on social media with men who are portraying a bad message or some different message or whatever the case may be. So
Yeah, I
anyways.
think the politicization of Dr. Peterson's work is so unfortunate because his messages are very straightforward, especially like the 12 rules for life. The fact that it was coded right was so unfortunate because there's not a child alive or a parent alive who wouldn't benefit from very straightforward, useful advice. And,
Right.
the politicization of so many things in the society kind of messes it up for us.
It does. Yeah. I mean, it's not like the 12 rules for life is not like he's like made this like genius, like 12 rules. Like they're rules that have been around forever. He just like put them in a book succinctly, and everyone can follow them. Anyways. Yeah. I mean, we could talk about Jordan Peterson for hours, but maybe we'll get in trouble. But,
I'm already in trouble. I've come to accept this state of trouble.
Yeah, well, maybe when we get into these later topics, we'll really hit the nail on the head. But I did want to talk to you about OCD. It's something that I don't fully understand. So what are things that people in general misunderstand about OCD?
I think there are these common misperceptions about OCD just being about cleaning or about being very, very organized. People will kind of use it as an adjective if they're just like very neat. And they'll say like, I'm so OCD. And that categorization could be pretty difficult for someone whose whole life has been turned upside down for something that looks very different than that description. So, OCD is characterized by intrusive thoughts, images, or impulses that are unwanted, repetitive, and, don't stop even when you want them to. And in response to the distress caused by those, you'll engage in compulsions, which are either thoughts or behaviors aimed at reducing the distress from the obsessions, right? So you have like the obsession, and it could be something like, if that bed is dirty, right, it might have blood on it and I might get AIDS, right? And you could totally know that doesn't make any sense. You could be a biologist and totally know, but it's like, what if, right? The one in the million, right? What if, another example would be harm-related OCD, where, I'm just cutting vegetables, standing next to my friend, we're going to barbecue, and I'm like, what if I just plunge this knife into my friend, right? Like technically I could, like with a very sharp knife, and he's right there, and we're talking. Like, so that's that, so someone without OCD might have that thought and be like, oh, that'd be crazy. I would never do that. And then when we continue the conversation and cutting the vegetables, with OCD, you kind of attribute meaning to that thought, right? And you're like, maybe having that thought means that I'm more likely to do it, which could cause a tremendous amount of distress because you could love your friend and you would never ever do something like that. And you might want total certainty that you would never do that. So you might spend like the next hour trying to think of all the good feelings and bad feelings you have about that friend and make sure that you have no enmity towards him so that you won't stab him, right? Or you might, stop cutting the vegetables to make absolutely sure that you're not going to stab him, right? So it's all about avoiding that uncertainty, right? Of what if I do it? and doing these unhelpful behaviors to make sure it doesn't happen. So maybe he'll only cut vegetables with plastic knives, right? So that's like different themes of OCD, and it could be extremely disabling because maybe you're spending the whole day thinking whether or not you're a murderer. You're walking down the street wondering if you're going to push someone into traffic, right? And it could just, if it's not contained, it could generalize, right? And it could really be disabling, and it's something that there is good treatment for. But some people won't even know that they have it because they associate OCD with just dirt and germs and cleanliness.
Yeah. I mean, because a lot of us have had the thought, like maybe while driving, like, oh, what if I just drove off the side of the road here? You know,
Mm-hmm.
how do you know if that just one pervasive thought is, if it's reoccurring all the time, is that something that you should be like concerned about and maybe seek some help about? Or if it's just one time, is that something you should be concerned about as well?
I think that gets into the question of ego dystonic versus ego syntonic. Like if you have a thought of, like what if I stab my friend, and you're like, that would be kind of nice, right? Like that, like I don't want him around. Like that's not OCD, right? It's usually based on something that's so different, so so against who you are,
Mm.
so against your character, and that's why it's so disturbing. So that's called ego dystonic, right? So that's like a pretty key characteristic of OCD. And further, it like the D in OCD stands for disorder, right? So at the point where you're experiencing this and it's causing impairment in your functioning and your quality of life, then it's worth talking to someone about it. If it's like you have a bad day and a bad thought, and the next day it kind of didn't bother you, then good. Like go along your merry way.
Yeah. And if someone comes to see you with that, what are some of the treatments that you might employ on them?
Sure. So the first line treatment is exposure therapy,
Mm.
which I do with both adults and children. And so let's take the example of the stabbing the friend. So like maybe in that case, if they're avoiding, any sharp knives that they've locked away, they need to slowly learn to unlock them, right? They're learning that a thought is just a thought, and that they're not in any more danger of stabbing their friend than anyone else is, right? So you might have them chop vegetables near a friend, or maybe if they're thought blocking, right, because it's so disturbing, that thought, that they're actively trying to not have that thought, which only
Mm.
causes it to be more frequent. Like learn to just have that thought, and there's nothing dangerous about the thought itself. So that's called exposure therapy, and it's a very effective therapy for OCD. There's some evidence that SSRIs, selective serotonin reuptake inhibitors, could be effective as well, but I would only suggest that for individuals who are not having success with the exposure therapy, or if their OCD is so severe that they can't even engage in treatment. Some people do benefit from the medication. Additionally, there are some other psychotherapies. Some individuals who don't get better with ERP will potentially, there's something called acceptance and commitment therapy, which enhances the ERP. It's also an exposure based therapy, where you're kind of really focused on the values and moving towards values. And it's a mindfulness based therapy, which helps you be in the present moment and not get stuck in your mind where a lot of this is going on. There's also inference based cognitive therapy, which is becoming more popular, which is a good second line treatment where you're kind of helping someone recognize what's called the inferential confusion, and kind of stepping out of that bubble before you get sucked into it, and recognizing like it's a more complicated therapy, but some people really respond to it.
Hmm. Interesting. I know you mentioned at the beginning that we're sort of over diagnosing. do you think that there's over medication as well? Do you think that's an issue as well?
Yeah, I do think that the way medication is prescribed presently is like a person comes in to their primary care physician and they're just saying, I've been feeling down. Um, and a physician may prescribe a medication straight off the bat, just like, oh, you're feeling depressed, like you meet criteria. Let's just do it, see if it works. And if it, I think that model is not helpful
Mm-hmm.
because there are many people who, like I said in the beginning, like humans, feel depression for a reason. And sometimes it's because they are not doing what they want to be doing with their life, right? So rather than, so that's the case with some people, and maybe they need to talk to someone and make changes in their life that they're afraid to do, rather than just like take something that will reduce the pain. Whereas other people, like that might not be the case, and they have this, you know, irretractable depression that no matter what changes they make, they're still feeling this way, and they find, that the medication helps them live the life they want to live. So I think, like, unfortunately, because the state of healthcare in America is what it is today, being able to see a therapist is not easy, to disentangle which situation you're in, and to work carefully with a psychiatrist and a psychologist and a team. Like, I feel like that's really, unfortunately, very difficult to access. So I think, people are then left to just go to the pediatrician or the primary care physician, take a pill and see if it works. But it's not ideal, and I think it leaves a lot of people on it who are not benefiting, though there are some people who really do benefit from it. So I'm not part of the anti-psychiatry camp where they're like, under no circumstances does this help anyone, and it's the worst thing ever, nor am I the person who treats it like Tic Tacs. Yeah, it's it's probably, it does work for some, in my experience.
Yeah. Yeah. I mean, I only ask because I have a very personal experience when it comes to it. And
Mm-hmm.
yeah. So I mean, I'll share with you. It seems fine.
Yeah,
I
sure.
lost my sister, Rachel, about 6 years ago to suicide. Um, and for her, like as a family, we exhausted a bunch of different measures before we got on her medication. And medication like takes a while. Like she was on too heavy doses at first, and then you got to come back. And then so like eventually she found the right dosage. And for her, I truly believe that the medication she was on extended her life for as long as she lived. And so for me, when I think about medication, I'm like, there's about maybe 1 to 3 things that we need to exhaust before we hit that point. And now she had severe bipolar disorder and schizophrenia. So like she was struggling with a lot of different things. And
Mm-hmm.
so I think with that, like definitely was super beneficial to her. She was still able to, graduate college and get a job and do all these great things. Um, but like there was a bunch of stuff we did before that. I say we as in like my parents did before that to try and help her, talk therapy, some other stuff. Um, you know, and then like it was the right choice based on some of these things that led up to give her that medication. And I think if you have that ability to go through that process and exhaust some of those measures of maybe doing exposure therapy or thinking about this or talking to someone, and then like, okay, we've tried all of this. Now maybe it's time to do this. And then, potentially there's psychedelic research coming out as well that seems promising. So maybe that's a cool avenue that people can try. Of course, with a professional, don't do it recreationally, obviously. Um, and so that's where my head goes when I think about, medicine and my sister's journey. I just wanted to share that.
Thanks for sharing that. And I think you bring up a good point about, there's a difference between schizophrenia and bipolar disorder, where, likely medication would be the first line treatment, and
Mm,
then part of therapy might be, how do you manage the side effects of those medications? How do you live your best life with these conditions? How do you keep your social rhythm when it comes to bipolar, like where you're sleeping and you're eating and you're taking care of yourself. Like, how do you keep that up? So I think like that would be different than kind of like normative uh, kind of suffering that is part of, you know, being a person,
Right.
and like being able to distinguish the two, requires some expertise to see like where is this something that, you know, this type of suffering that someone could grow from, and the type of suffering like that seems more organically based, mental health condition like schizophrenia.
Yeah. Yeah, that's a very, very important distinction. Like, are you going through a breakup and you're sad? Or like, is this like some serious depression that's been going on for, a couple months now and you can't sleep and you don't feel like you want to eat and like, or are you just like sad because someone you loved doesn't want to be with you anymore? Like those are two very different circumstances. Some of the same emotions, might come up and it might feel the same in like your body, but they
Mm-hmm.
happen because of two very different things. And I think that's also something that we can express to kids and like try to tell them about, like, yeah, you're gonna get fucking dumped, man. It's gonna really it's gonna suck. It's gonna really suck,
Yeah.
and you're gonna get rejected from a job, and you're not gonna get into school of your dreams, or like some stuff is gonna happen, and that doesn't mean you're like in a serious downward spiral. It just means like you're feeling some things, and there's some tools that you can use to help you recognize which path you're going down. But yeah,
Yeah. I
anyways,
feel like
that's
you're
more
going to
so
be a
my
solid dad when the time comes.
I hope so, man. I hope so.
Yeah.
It'll be a challenging job, but I'm going to do my best.
Yeah.
Um, all right. The last thing I want to talk to you about, maybe the most contentious thing, is
Let's do it.
what are your biggest concerns when it comes to the youth gender medicine and some of that stuff that's going on?
Great question. I'm a big supporter of evidence based medicine. And I think the way the medical and the psychological establishments have been helping kids who either are uncomfortable with their gender or are questioning their gender is not based in evidence based medicine. And increasingly, um, states are realizing that, countries in Western Europe are realizing that. And I think America is kind of like, once again, based on the system, is the holdout. And they're practicing what's called like the affirmative model of psychotherapy, which attributes uh, the suffering of someone who is, questioning their gender. They're attributing it to like being in the wrong body, of like really being trans, and they're going, rather than trying to really work with someone to really understand all the underlying factors that may be leading them to be uncomfortable in their body, they're kind of really going straight to the medical pathway, which, not only is not shown to be helpful for gender dysphoria, there's like a lot of very serious side effects, including sterility, infertility. Um, you know, there are certain procedures which are deadly. A person recently just died based on complications from a phalloplasty. So I think holding this branch of medicine and mental health to the standards we hold all other treatments is very useful, because when a person is experiencing dysphoria, gender dysphoria, there could be a lot of other things going on. When a female believes she was born in a wrong body, and she has a history of sexual assault and a history of anxiety and depression, and a ton of family conflict, and then the parents get divorced, and then the next 2 weeks, she's fallen in with a crowd of friends who all identify as non-binary or trans. And for that person to go to a mental health professional, and instead of getting therapy to unpack all of that, instead they're kind of being shuttled to an endocrinologist for hormones, I think is real disservice to these kids. So a lot of people are hesitant to say what everyone really knows privately. Like, I've spoken to psychologists and psychiatrists who, you would recognize their names, and they're major players and they're authors and they're tenured professors, and they're like, under, privately they'll say like, yeah, this is really messed up. I've spoken to so many of them, and they realize that what's going on is not helpful, and they're very much afraid to say anything because of the blowback. Though I think increasingly it's becoming less, like, it's more acceptable to express doubt, given all of the evidence coming out demonstrating it's not so helpful, such as the Cass report in England. So I think it's at least acceptable to discuss it now. But for so long, all of these psychologists and doctors could only talk about it, in secrecy. So it was very important for me to speak out about this. I think, as Jordan Peterson says, like, I think telling the truth is extremely important. And, I think that's what I did, and I've never had any regrets since.
Yeah, his best quote is that if if you want to live an exciting life, Dr. Elliot, all you got to do is tell the truth. And I feel like that's like spot on, like, because you never know who's gonna take it which way or another. But man, in your heart, you're telling the truth, and that's cool.
Yeah,
so
and one other quote I will say of his is that if you tell the truth, any consequence that happens from that is the best possible consequence, right? So I find that to be so true. Like, sometimes it may seem that there's negative consequences and maybe a colleague won't talk to you, or someone will get upset at you, or maybe someone will complain about you or harass you online. But it's like, when you look at the big picture, you will never have a regret from being honest, is what I believe.
Yeah. Last question to wrap us up. What do you hope happens moving forward with people in your profession?
I think in this domain, I would say that people with gender dysphoria actually get good psychotherapy. And I'm part of an organization called Therapy First, that while they're branded as some evil, conversion therapy house, it's a bunch of very liberal therapists. A lot of them are gay in that community, and they're just like the first line treatment for a kid who's suffering, with gender dysphoria should be therapy, and not, the endocrinologist or the plastic surgeon. So I think I would like there to be more acceptance that this should be the first line treatment, because now there's this weird schism between those who are actually able to be open and honest about it and those therapists who are like activists with a therapy degree, who are really just attributing everything to gender dysphoria and advising kids to do things that are not supported by evidence. So I think that would be a major change, because I think parents are not trusting therapists when their kids need it because of what they know sometimes happens. So I think it would be a big help for the field if they reconciled or came to a healthy outlook on this issue in particular.
Yeah. One thing that like really bothers me about some of the like gender ideology is when they say that if you either have two choices. You either affirm your child's identity, or you have a dead child. Like, and that to me is like how can you say that to someone? You're talking to a parent who loves this person in front of them, like we talked about, and you're saying these are their only two options. That's it. Not like, hey, let's go talk to someone. We can work this out. We can express some ideas. We can cultivate some new things and explore some ideas. And maybe this works for you and this works for you. But like, there's not like, to me, like obviously losing someone to suicide, like it's a fucking real thing that can happen. And so now you're just throwing it in someone's face, like a parent, like that has to stop, because if it doesn't, there's no way to reach a point where we can actually help kids who are feeling this way, or who need help in these ideas, or just need a sense of belonging, or just want to just need a friend or a supportive person to talk to, or whatever the case may be. There's a spectrum of ideas that could be real. But if we only say these are the only two options, excuse me for getting fired up,
No.
then we're never going to get to a place
I'm
that's
equally fired up. It's
yeah.
untrue. It's not founded in evidence, and there's no evidence that any of these medical procedures reduces the likelihood of suicide. So it's an example of, like, the greatest example of emotional blackmail that I've ever come across. And it's good that you're sensitive to that. And I hope, in the future, doctors will, stop, promulgating that real manipulative lie.
Mm-hmm. Yeah. Well, thank you, Dr. Elliot. I appreciate you. Where should people go if they want more of you?
Sure. So I do parent consulting at Serenity Parent Consulting, and I do business consulting at Glasswall Consulting. And I'm a psychologist at the Center for Child Behavioral Health and myscare.com.
Sweet. Thank you. Great to meet you. Great to talk to you. And I really appreciate the work you're doing.
I appreciate it. Thanks for having me.
Thank you very much for tuning into that episode. And if you enjoyed it, click right here for another full-length episode of the podcast. And please don't forget to subscribe. But most importantly, above all else, please take good care of yourselves and others. And I'll see you next time. Lots of love. Cheers.